Bulimia, or BN, is a disorder that is characterized by a feeling of loss of control that accompanies a series of binge eating and compensatory behavior. The most well-recognized compensatory behavior is purging, in which people suffering from BN vomit, use laxatives, or other purging behavior to physically rid themselves of the food that they eat. The less recognized, but perhaps more common non-purging form consists of compensatory behaviors such as excessive rigid exercise or not eating for abnormal amounts of time after a binging episode.
Seriously? I just did these dishes. I just took this trash out. She ate a whole one of those. God. Natalie?
Yeah?
Can you go do your dishes, or can I move them so I can do mine?
Oh, sorry. I'll do them when I get out of the shower.
She's been in there for like a whole hour.
People suffering from bulimia nervosa usually try to hide their symptoms, so it is important to pay attention to any warning signs. For example, there may be indications of large amounts of food consumption, such as large amounts of candy wrappers in the trash or sudden piles of dishes, frequent or long trips to the bathroom, especially after food consumption, running water and/or playing loud music while in the bathroom for long periods of time, signs or smells of vomiting, discoloration and staining of the teeth, the presence of many laxative boxes in the cabinet or trash, excessive exercise regime, especially with conditions that would normally prevent the exercise, such as injuries or bad weather.
That was a really fun birthday dinner.
Yeah, I ate so much cake and drank so much soda after the bathroom so bad.
What the heck? You're going to the gym?
Yeah, I need to burn off that cake.
It's 10 o'clock, and don't you have a midterm tomorrow? Hey, can I talk to you for a minute?
Yeah, let me just hop in the shower really fast.
Didn't you already take a shower? What were you doing in there?
I need to wash my hair.
And you didn't do that in the first shower? Seriously, what's going on?
Nothing's going on. I just want to feel clean.
Look, I don't want to be mean or anything, but I've been seeing really strange stuff, like a bunch of candy wrappers in the trash, a bunch of dishes in the sink.
I told you I'd wash them.
You're always running to the bathroom after we eat, and you're in there for hours.
Nothing
You're
is
always
wrong.
talking about your weight and your exercise. Don't shut me out.
There are a variety of symptoms associated with bulimia. The common symptoms include negative self-perception, exclusively talking about losing weight, binging, and effects based on compensatory behavior. Vomiting is the most common compensatory behavior, and common effects include painful and swollen throat. Tooth decay caused by stomach acid wear on the protective enamel, which results in tooth pain. Acid reflux and other gastrointestinal problems. Dehydration, which causes symptoms such as fatigue, nausea, and vertigo. Laxative usage symptoms include gastrointestinal upset, dehydration, damage to intestinal tract. There are also non-purging behavior symptoms which are much more difficult to identify because they are common behaviors but done in excess, such as intensive exercise symptoms. After a binge, non-purging bulimia sufferers abnormally alter their food intake. This includes amount and types of food.
So why seek help now?
My roommate and I were talking, and I realized how bad this has gotten, and I think I just need some help.
Okay, so what's troubling you?
Well, I can't stop obsessing over the way I look. Every time I wake up, I hate myself. I don't want to go out because all I can think about are the calories and how I can get rid of them.
So what do you do about this feeling?
Well, it's gotten to the point where I can't go out with friends or anything like that. Everyone thinks I'm a happy person, and I'm really not. I'm literally just hiding in secret, and I just can't stand the thought of gaining weight. It's a daily struggle, and my whole life revolves around it. I even plan out my schedule for when I can eat.
Okay. And so in what ways do you deal with that?
Well, I go to the bathroom and turn on the shower so no one can hear me. And I throw up, and afterwards I spray perfume. I'm literally in there for half an hour, and I turn on the fan and try and hide everything.
So how do you feel when you exhibit this behavior, this hiding?
I feel super ashamed, just the fact that I have to, like when I do eat, I need to throw it up and get rid of it right away.
And how often do you exhibit this purging behavior?
Almost every day.
Is there any other sort of compensatory behaviors that you do to
I run 5 miles every day to burn off the calories too. That's like another way for me to deal with it.
Okay, and how long has this been going on?
Since my freshman year.
Okay, and what year are you now?
Senior.
So what happened during your freshman year when this started?
I was super stressed out, just from the transition from high school to college, and moving away from home and going to Cal Poly and seeing all the pretty and fit girls.
And seeing all these girls, how did that make you feel?
It made me feel super upset just about myself. There were days where I wouldn't even get out of bed and I would literally miss class.
There isn't a single cause of bulimia, but a variety of factors can influence this behavior. Societal standards of body image and emotional factors such as low self-esteem can increase the risk of developing BN. Disturbances in serotonin levels and family history can also factor in as to causes of bulimia. Other factors such as high stress levels, dieting, history of trauma or abuse, major life changes, and poor body image can also contribute to the development of bulimia. Some reported U.S. statistics include a yearly prevalence of 0.3%, with an outstanding 954,000 people reportedly having BN. Females are 5 times more likely to be diagnosed over a lifetime, with the average age of onset being 20 years old, and there is a lifetime prevalence of 0.6%, meaning that approximately 1.9 million will develop BN sometime in their lifetimes.
Okay, based on your symptoms, it seems like you may have something called bulimia nervosa. And since this has been going on for more than 3 months, and you have your symptoms more than once a week, we can go ahead and treat you for that. But it also seems like you may have some symptoms of depression, so we're going to try and treat you for that as well. It's actually fairly common for young women to develop this disease. In fact, it's estimated that 1.9 million women in the United States will develop BN during their lifetime. It is also commonly seen that there'll be depressive or anxious symptoms. So we're going to have you return probably about once a week. We're going to try some cognitive behavioral therapy to see if we can help you figure out alternative ways to deal with their stressors in your life. But I'm also going to send you to Dr. Chloe. She's a psychiatrist, and hopefully she'll be able to help you and prescribe you some medication that'll help you deal with your binging and purging symptoms as well as your depression.
Most common conditions that occur comorbidly with BN include anxiety, depression, and substance abuse. There are various types of treatment available for people who have developed BN, including different forms of counseling and medication. Common forms of counseling include cognitive behavioral therapy, interpersonal psychotherapy, and nutritional counseling. Drugs and medication most commonly used are antidepressants such as fluoxetine, fluvoxamine, and sertraline.
Decided to prescribe you with an antidepressant called fluoxetine, which may help you reduce your binging and purging habits as well as help with your underlying depression. Don't worry if the first medication doesn't seem to be effective. Everyone is different. And do you have any questions for me?
No, that sounds good.
You can pick up your prescription at the front desk.
Okay, thank you.
Unfortunately, remission rates are very low, 20 to 40%. CBT is the best recommended therapy with a success rate of 40%. Fluoxetine is considered to be the best medicine with a remission rate of 20%. Combining the use of fluoxetine and CBT does not appear to increase the remission efficacy. Efficacy of treatment is partially due to future stressful events in a patient's life, as stressful events can cause patients to relapse. Other factors such as the patient's available social support support. Treatment of underlying causes such as body dysmorphic disorder, depression, and/or anxiety contribute to the efficacy of the treatment.
Although you may not be a specialist in the field, there are different ways in which you can help. Know and be aware of the signs and behaviors. Supportively speak to the person that seems to show signs of bulimia. Listen to the person speak about their feelings without judgment. Get help when you think something is wrong because early intervention is key. And be aware that bulimia nervosa may arise in both male and females.
Once again, here are the warning signs to be aware of. Please note that not all people that exhibit these signs have BN, and not all people with BN exhibit all or any of these signs. If you are concerned, it is best to try to talk to the person and encourage them to seek professional medical help if need be. Finally, here's the contact information for on-campus help.